Even more pressure building on young doctors in South Korea to end a large-scale walkout that has crippled hospitals. Police have raided the offices of the country's largest medical association, accusing it of instigating mass resignations of trainee doctors. Now, the raid marks the first round of investigative action by authorities after thousands of junior doctors defied a government deadline to return to work by the end of yesterday or face suspension of their medical licenses. The Health Ministry says a total of 565 doctors returned to their duties by the strict deadline, but there seems to be no end in sight to the dispute, as more than 8,000 physicians remain off work. The junior physicians are protesting the government's plan to increase the number of students admitted to medical schools each year by 2,000. They say the government should first address pay and working conditions before trying to increase the number of physicians. The mass walkout is taking its toll on medical centres across the country. Operations including surgeries, emergency rooms and intensive care units have been significantly reduced. Some hospital chiefs have made an appeal for doctors to return so they can treat patients. One doctor who helped mediate the dialogue with the government in the initial days of the walkout told CNA that inadequate government policies are to blame for the current predicament. She says that doctors who are still at work are close to collapse and that the blame should not be put solely on one profession.
필수 의료 현장을 지키는 전문 의사들, 필수 의료 인력들은 어제 교수님들 얘기를 들었더니 이제는 쓰러질 것 같다. 그냥 사직서, 나도 사직서 내고 싶다. 힘이 들어서. 정부에 대한 저항이 아니라 지금 벌써 열흘째 되고 있기 때문에 거의 180시간 이상 중노동을 해오고 있거든요. 물리적 마비 상태입니다. 응급실에서 1시간 기다렸기 때문에 의사 때문에 생명을 잃었다. 이렇게 프레임을 씌우는 것은 잘못입니다. 한 명의 직군이 대량의 국민 건강을 책임질 수는 없고 이것은 국가의 정책 조정으로 반드시 만들어져야 되는데 국가는 지금 의사 직군에 대해서 아주 부당한 프레임을 씌우고 있다고 생각합니다.
But the government is standing firm on its stance. Seoul says medical reform will go ahead without question. And this as polling shows up to 75% of the South Korean public support the government's reforms.
의사 확충은 국가의 헌법적 책무인 국민의 생명과 건강을 보호하기 위한 최소한의 필수적 조치로서 협상이나 타협이 대상이 될 수 없습니다. 정부는 오직 국민만 바라보고 흔들림 없이 의료개혁을 완수하겠습니다.